Hello, my name is Dr. Gloria McMenamin. I'm a dentist from Towson, Maryland. I'm going to be talking to you about dental implants today. If you're thinking of replacing some of your teeth, here are some of the things that you can get. So, what are your options? You have some removable options and fixed options, and also some implants. This is one case where you have a missing tooth in the front. And these are some of the advantages and disadvantages of implants versus conventional treatment. For an implant, it's more natural looking. It preserves the bone and the adjacent teeth, and it's fixed in the mouth, and it also has a very high success rate. Why dental implants? Dental implants are time tested, they're conservative, they have high success rates. It preserves bone and adjacent teeth and soft tissue, and it can be used to stabilize complete or partial dentures. This is how a conventional fixed bridge looks like. It has two natural teeth and then what we call abutments. So it requires reduction of natural teeth, which is not very good. And it can be difficult to clean because you have to floss underneath the bridge. The disadvantages of conventional treatments are they can have unsightly clasps like this. They can be bulky and uncomfortable, and since they're removable, you can lose them. So who are the good candidates for a dental implant? People with good overall health, non-smoker, no prior use of bisphosphonates like Boniva, Actinel, or Fosamax, and good oral hygiene and someone who comes to the dentist on a regular basis for maintenance. The contraindications for dental implants are smoking, uncontrolled periodontal disease, diabetes, uncontrolled diabetes, and then people with osteoporosis. As you can see, the bone is more dense in the normal bone compared to osteoporosis. And also another one is bruxism or night grinding, because you can see the broken teeth and the implants can break as well. So what are the things that we need to do pre-surgical planning? We need an upper and lower diagnostic model of the teeth, and intraoral photographs, and also extraoral pictures. We take a CT scan, which is a 3D X-ray image in 3 dimensions. And this is how it looks like. So the CT scan identifies important structures like the mandibular nerve or the sinuses. And then once the CT scan is exposed, then you can see where, like in 3D images, where the important structures are. This is how it looks like. And people have different bone densities, and it's best to explain it like wood. And I will show you here a model of different kinds of wood. Class 1 bone is like maple or oak. Class 2 bone is white pine. And class 3 is like balsa, and class 4 is styrofoam. So people with osteoporosis are more like class 4 bone. So the ideal bone that we need is 1 and 2, like maple, oak, or white pine. Other important considerations are that adequate bone. Bone is evaluated in 3D. First, the height. It has adequate height, adequate width, and also the depth. So after all the diagnostic data has been collected and surgical planning has been done, treatment planning and surgical planning, then a surgical guide is made. It looks like this, and as you can see, all the important structures are already identified, where the sinus is, the mandibular nerve. So this is where the dentist or the oral surgeon will exactly place his drill. It is, as you can see, it's very conservative. It doesn't involve any incision. It's made with a tissue punch, so only where the sleeves, the round sleeves are, that the drill is placed. After the surgery, then we go next to the healing phase. This is what you call a healing cap, and it takes about 3 to 4 months, sometimes 2 months. It depends on each individual. And then this is the result, and this is an example of an implant supported denture. This is when you're going to put a complete denture, this is how it looks underneath. And then also, especially if it's a front tooth, we need to temporize, so you can walk around with teeth. And this is called an S6 retainer, and this is what you call a flipper. And after the healing phase, then the final crown is put in, and it looks like this. So these are different kinds of implants. This one is an overdenture, where a complete denture is supported by 2 implants. And this one is something popular that is done more now, which is called all-on-4. It's a fixed bridge that supports also a complete denture, whether upper or lower. And this is another denture supported by implant. So as you can see, whether you have several missing teeth or just one tooth, then you have the option of having something fixed. For the long term, implants are more of great value, because sometimes if you do them once, you don't have to replace them. Unlike removable dentures that you have to replace them every 5 to 10 years, which would cost you a lot more in the long run. So you're welcome to have any questions and a free consultation at my office. I'm Dr. Gloria McMenamin. I'm located in Towson, Maryland. Thank you.